Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest today is Anish Sebastian, CEO of Babyscripts. Anish, thanks for joining me today.
Logan, it's always good to be here, man. So.
Yeah. It's been exciting to see Babyscripts grow over the years. I've gotten to interview you over time. And one of the greatest things about your story, in my mind, is that you started a company to help women have healthier pregnancies before you were married, had children, when you were still a bachelor, and yet here you are sitting, a father of a 2-year-old, and so you've had your own journey, which I'm sure has impacted the company. So, first of all, what's it like having a 2-year-old at home?
Yeah, Logan, you're totally right. As the company has grown, so has my family. Right? When we started, I was a bachelor. Right? Those were the old days. But my kid just turned 2 last week. So that's been quite the journey. He's getting more emotional now, every now and then throwing a temper tantrum. So I think that's a sign of things to come.
Yeah.
But I mean, all joking aside, I think going through the pregnancy journey, particularly the postpartum journey, to me has been completely eye-opening. Myself and my wife's a trained OBGYN, by the way.
Oh, wow. Okay.
Yeah, we thought we sort of knew how to do the whole pregnancy, postpartum thing.
Yeah.
And little did we know, we barely knew nothing.
Right.
Yeah, it's all kinds of questions, open areas, gaps in care. So it's a big deal, and it just reinforced the mission and the vision of the work that we're doing.
Which is a good segue to explain exactly what is Babyscripts. What have you built?
Yeah, so let me first just say, today in the United States, we do an entirely poor job of taking care of our pregnant moms. If you look at statistics like maternal morbidity and mortality, it's been going up. In fact, through the pandemic, it's gotten worse. Yeah. So we're one of the worst, actually the worst of any advanced country, right?
It's wild.
And we think that one of the core problems is proper, good access to care. And that's what Babyscripts does. We have a technology platform using mobile devices, smart connected devices, that helps providers, OBGYNs, nurse midwives, nurses, primary care physicians, allowed to remotely monitor pregnancies, low and high risk, and really take the care outside of the 4 walls of an office or a clinical setting into the patient's home, right? So
let's get really practical about it. So let's say the access issue, let's put a face on it. A woman gets pregnant. She says, I'm not sure I can afford going into the OB every month, doing sort of that standard checkup. Yeah. So I'm just going to hold off. What are some of the...
Well, think about it very pragmatically, right? They might have to take several days off of work. They might have to think about childcare for other children at their home. Right. These are day-to-day challenges that, moms face. So if you can do a visit remotely or take blood pressure at home, there's no need to take half a day or a full day off of work, pay $20 for parking. Parking's very expensive these days. And, see your provider for 15 minutes, right? Yeah. So a lot of what care that's happening today can be taken into the home outside of the clinical setting. And really it's a no-brainer now. Yeah. And that's what we really do, so.
What are some of the other downstream benefits of that remote care? I mean, you just said not having to pay for parking. That's just like a tangential benefit.
Yeah.
But what are some of the interesting health benefits?
Yeah, the biggest benefit is better quality outcomes for the pregnancy itself, right? So whether that's detecting risk earlier so providers can intervene, or it's avoiding an adverse outcome, like a complication in the postpartum time period, avoiding a readmission that might take place after the delivery. Just better outcomes, healthier moms, healthier babies, right?
Have you been able to quantify some of that?
Yeah, I mean, the things that we look at is actually mostly around the postpartum time period, and that's where the highest risk is. So one of the things we look at is postpartum hypertension management.
Okay.
So whether it's detecting that risk earlier, reducing readmissions back into the hospital, not only have we quantified it, we've actually published and shared on it too. So it's clinically validated results that we're sharing. So definitely have some good results there. So.
Okay. Talk to me about where the company's at. How many OBs are you working with? How many pregnancies have you helped?
Yeah, so today we're in about 27 states.
Okay.
Our book of business is about 300,000 pregnancies.
Okay.
And it's growing monthly. And I think one of the things that we're very proud of is, last year we rolled out a maternal mental health module.
Okay.
Really aimed at identifying, perinatal mood and anxiety disorders. And that could be as simple as just being anxious during pregnancy, or as bad as depression, and obviously worst case scenario, suicidal ideation and thoughts, right? So identifying where the risk is sooner and getting them the care that they need is something we're very proud of. And we're hoping to sort of roll that out this year and really just grow and take that to the next level. So,
all right, let's go back to your baby being born 2 years ago. What was the biggest surprise?
Yeah, I mean, I think I go back to the biggest surprise being, the all of the gaps in the postpartum time period, especially those first 6 months after you come home with the baby, right?
Yeah.
And that's not just for the baby, but quite frankly for the mom and the dad to a certain extent, right? Everything from breastfeeding to, if you have a C-section, like healing issues there, to getting back to life and work as normal, right? So there's just a lot of things going on, and I think we do a poor job of equipping our moms with the proper tools that they need so they can get back to life as normal, right?
Yeah,
so.
You have this newborn and you're thrust into this sort of black hole, this like sort of crazy sleep-deprived phase.
Yeah.
And the world is just sort of congratulating you for having a baby.
Yeah.
Did that moment for you, experiencing that, did that make you want to extend care further forward?
Yeah, we actually go 1 year after the delivery now.
Okay.
Yeah.
Okay.
And I'll just give you a very pragmatic example. So for high-risk moms, you're supposed to come in for an appointment 6 days after the delivery, 6 to 18 days essentially. Think about it. You have a 6-day month at hold.
It's terrible.
You might have another kid. The last thing you want to do is like take the baby and go into a clinic, right? And really the big thing you go in for is remote blood pressure monitoring, or blood pressure monitoring and answering a bunch of symptomatic questions. No reason why you can't do that through an app or through an at-home program or through a telemedicine appointment, right? So that's just one very simple example, but you can take that and apply that all over the place. And I think hybrid care is here to stay, and particularly for the users that we serve, they typically tend to be young, tech savvy, might I even say millennial, right? So it's silly that we're still expecting folks to sort of turn the car on and drive 2 hours for a 15-minute appointment, right?
Yeah.
So.
When you read about maternal health stats being really abysmal right now, you can't help but read about the disparities in care based off of the race of the patient. So how do you feel like opening up access to care helps with health equity?
Yeah, absolutely. So just to re-emphasize the stats there, if you're black or brown, you're 2 or 3 times more likely to have an adverse maternal outcome.
It's wild.
So that's terrible, right? We think access to care is a big part of that. We also think that for a lot of moms out there, you just have a fundamental issue with trusting the healthcare system.
Sure.
So a lot of our tools identify these risks earlier and get the mom the care they need. And a lot of times that's not the white coat MD, right? It might be a care navigator, it might be a health coach, it might be a case manager, right? So just building that trust and connectivity is super important.
Awesome. Anish, what are you most excited about for the company for the next 12 months?
I mean, I think we're at the precipice of maternal health becoming a major tenet of decisions being made at healthcare institutions, right? It's no longer in the back of the line. It's starting to move up to the front of the line. And that's an exciting time for our business, for whether it be a payer executive or healthcare system executive. We're part of those conversations, and ultimately, moms win, right? That's what we're all about, and that's something we're excited about. So.
Love it. Anish, so excited for Babyscripts and what you're building there. Excited that you have this 2-year-old at home educating you.
Yeah,
and,
a lot of education going on.
Keeping
buddy.
it real.
I'll tell you that.
I think your company's probably going to be better for the fact that you've gone through that personally, and you can share that with folks.
Absolutely, yeah.
And it's going to be an amazing year. So congrats.
Yeah. Logan, always good to talk to you.
All right, take care.
Sorry to move the mic.